Can you state your name and age, please?
My name is Harry Demkee. I'm 51 years old.
Do you have an artificial cardiac pacemaker?
Yes, I do.
At what age did you have your first pacemaker put in?
My first pacemaker was installed when I was 26 in 1987.
And why?
I experienced some lightheadedness and some dizziness and some fatigue, and I went to see my doctor, and they took my pulse, and my pulse rate was coming up at a resting rate at the time of about 14. I was immediately referred to a cardiologist. They completed an EKG and diagnosed me with heart block and referred me immediately to the hospital, where in the hospital the next day I had my first pacemaker installed.
Has any doctors ever given you any theories as to why you needed a pacemaker put in?
Yes, the theories have varied a little bit over the years. The primary theory was I did have meningitis as a very young child, as around 4 years old, and meningitis has some byproducts or side effects that could lead to heart damage, hearing loss, and thyroid problems, all of which I've had subsequently. More recently, I've had an infectious disease doctor theorize that I may have had Lyme disease that had gone untreated, that had led or been a progenitor to the meningitis. He felt the Lyme disease was a more likely cause.
For your first pacemaker, how many leads did you have put in?
The first pacemaker and the technology at the time, they only had 2 leads available.
Have you ever had a 3-lead pacemaker put in?
Yes, I've had biventricular pacemakers with defibrillators installed, probably the first one about 7 years ago. The first one had no complications, worked very well, strengthened my heart to a great degree, and then I finally had that one replaced in March of 2011.
Have you ever experienced any complications?
Yes. In August of 2011, I was on a business trip 3 months after I've had that original biventricular pacemaker replaced. While on that business trip, I noticed the surgical site, or the scar, over the pacemaker had become discolored. And it turned out to be an infection, which opened when I was asleep. The scar opened, and I bled. And I immediately went and sought medical attention at the time.
Have you had any other complications?
Yes. In trying to correct that problem, they had to remove all the old hardware because the infection could have followed the leads to the heart and damaged the heart. So I was referred to Stanford to have laser surgery to remove the old leads. Since the old leads were overgrown on the heart, it was very difficult to remove them. And when the surgeon was trying to remove the last one, it was so grown into the heart, he was trying to pull on it and was not having much luck, so he decided to try to turn it or corkscrew it. But unbeknownst to him, he corkscrewed it right through my heart and perforated my heart at the time, which required emergency open heart surgery to correct and save my life.
Any other complications?
After that, 14 months went by, and then in October of this year, I was on another business trip in Colorado, and I thought I had come down with the flu, and I had the chills, and I had a fever, and I had shakes, and I wasn't recovering from it. And after my wife and daughter encouraged me to seek medical attention, I saw a local doctor there who immediately dialed 911 because I looked so terrible, and an ambulance rushed me to the closest hospital, where I was diagnosed with a blood staph infection and endocarditis. After an echocardiogram, I was also diagnosed with damage to one of my heart valves, which required emergency open heart surgery to correct. And once again, a brand new pacemaker installed because the biventricular pacemaker leads had vegetation on them. This time they decided not to go with the more risky biventricular pacemaker that had that third lead that could cause or have risk for infection, and reinstall a 2-line pacemaker or 2-lead pacemaker.
So how many times have you had to have your leads replaced?
Originally, the first time I had the leads replaced or removed, but they originally were replaced in early 2002. But the first time I had to have them removed was in August of 2011.
And then you had them removed again in October of 2012?
Yes. This time, since they were there in such a short period of time, they didn't require laser surgery. They just came out without any problem at all.
Is that normal to have your leads removed ever?
No. Normally, they cap your leads off and they just leave them in there the rest of your life. It's pretty rare that, because I was at such a young age and started having pacemakers when I was in my 20s, most people get them when they're older so they don't have a large amount of leads piling up inside them because of when they replace them. So that was an unusual situation.
How many total pacemakers have you had to have replaced or renewed?
I'm on my 5th pacemaker now with varying, when we say pacemakers, biventricular and 2-lead pacemakers.
To your knowledge, are pacemakers, technology-wise, are they advancing?
They are, to a degree. The biventricular pacemaker was a great technology improvement because it really helps strengthen the heart muscle. Unfortunately, it also comes with the risk of infection. And at this point, weighing the risk of infection against that assist to my heart, I just could not have any more infections, so we went back to the original 2-lead pacemaker.
All right. Thank you very much.
Sure. Thank you.